Good morning. I'm Tammy Epps, and I'm the manager of media relations and social media at Prisma Health. And I have the privilege today to present to you our wonderful experts from Prisma Health. The entire team has been working tirelessly to make sure that you get the information that you need to make the right decision about whether you get your COVID-19 vaccine or not. So we have ready today to answer some of your questions. We are streaming this both on Facebook Live and on YouTube. If you have a question on Facebook, please put it in the chat and we will try to answer them. So our participants today on our panel of experts is Dr. Divya Ahuja, who's one of our infectious disease physicians, Dr. Casey Eichelberger, one of our OBGYNs in the upstate, Dr. Jackie Jones, who's family medicine in the Midlands, Dr. Freddie Rivera Rondon, who's a neurologist in the upstate, and Dr. Saria Sacoccio, who's also been chairing our COVID-19 vaccine task force. We are pleased to have all of them with us today, and they will try to answer your questions. Know that Prisma Health is here to help our community, and we've been doing that. So with that, I'm going to go to Dr. Sacoccio, and she will give you a little bit of information to get us started.
Thank you, Tammy, and thank you all for joining us today. This is an incredible opportunity to save lives. And by having you join us today, we hope to answer your questions that are specific to the vaccine itself. As we know, there are so many questions about safety and who's eligible for the vaccine, what type of temporary symptoms may someone have as their body is building that immune response. We have all the experts on the line for you today, and we look forward to having a dialogue this morning to answer those questions and perhaps encourage you and the rest of the community to step forward when it's your turn to get that shot in the arm. Tammy?
The next question, we're going to go to Dr. Ahuja. Dr. Ahuja, we have gotten some questions about how fast the vaccine has been developed and whether that people are concerned about whether the vaccine is safe.
Thank you, Tammy. Thank you, Dr. Sacoccio, and everyone else on the call. Tammy, can you hear me clearly?
Yes, sir, we can.
Okay, so and thank you to whoever is listening, either live or I guess later on. It's been quite a journey for the last sort of 9 or 10 months, and the vaccine is a sort of a possible end to this very surreal last 9 or 10 months. And the question is the vaccine safe? Is it a new vaccine? Are all of us being used as guinea pigs? As a full disclosure, I got my shot the very first day it was available. I was pushing other people away so I could get my shot. No, that's just a joke. I wasn't. But the point is, as an infectious disease physician, we've known that never has a vaccine been produced this quickly, but never has a pandemic affected the modern sort of era this rapidly and around the world. I lose track. I think 25 million cases around the world. 25 million just in the United States, and over 400,000 deaths. So this mRNA technology has been around for quite some time, quite a few decades. It's been looked at for in vaccines since I think 2012. But this year, at the speed of light, literally at warp speed, people have developed a vaccine which seems to be safe. It is not a live virus. It is not the virus at all. It's a tiny little bit of the virus, of the gene that is put into your body. It enters the muscle, then it helps develop the antigen that sits on the virus. That antigen on the virus is like the key that opens the lock when it enters our cell. Then our body develops antibodies. So if we get infected or when we get infected, because it's spreading rapidly, the antibodies attach to that key. So that key can then not open the lock in the cell. It's a safe vaccine. I just looked at the numbers today, and yesterday the CDC published data on vaccine adverse effects. There have only been 50 serious adverse events out of 12 million Pfizer doses. I'll repeat that, 50 adverse events out of 12 million. And that's too complicated for me to do the math, but it's pretty darn low. And in the Moderna vaccine, out of 9 million doses, there are 22 serious adverse effects. No deaths that have been linked to this. All of us will get some pain. All of us will get some fever and some fatigue and some myalgias. But I would say take some Tylenol. And as Dr. Saccocio and Tammy have said, it's the right thing to do. It's a safe thing to do, especially with this, as this disease moves very rapidly throughout the world. So I'll stop there, Tammy. We can talk about the variants, et cetera, as those questions arise.
Right. Next, I'm going to go to Dr. Eigelberger because there's a lot of questions about whether this vaccine is safe for those who are pregnant and breastfeeding.
Thanks so much, Tammy. I appreciate that. Yes. So lots and lots of questions for those of us who practice in the field. And this is what I can share with you. The actual vaccines themselves were not tested on pregnant women intentionally. That is very common in the United States and in Europe with drug studies and with vaccine studies. They are traditionally tested on people who are screened to be negative for pregnancy at the beginning of the inclusion in a trial. That said, 18 people who received the vaccine via trial were actually pregnant or became pregnant during the trial, and no adverse events have been reported in that group. That's just 18 people, but still we have no evidence of any type of plausible complication with pregnancy associated with vaccination. We do know vaccination in general in pregnancy is a very common recommendation. We recommend flu vaccination and pertussis vaccination for all pregnant women in the United States. And there's no reason biologically that we're worried specifically about mRNA technology. The American College of OBGYN does recommend full inclusion of pregnant women as the cohorts are being rolled out, that pregnant women be allowed access to vaccination. The Society for Maternal Fetal Medicine agrees. The American Society for Reproductive Medicine, that's the group that represents folks who do IVF and that type of reproductive technology. They recommend that getting the vaccine should not affect your timing of considering getting pregnant. And finally, the American Board of Breastfeeding Medicine recommends that women who are breastfeeding or lactating be allowed to continue to breastfeed, that they do not need to pump and dump, and that there's no biologic plausibility to the argument that getting the vaccine would in any way endanger a kiddo who is nursing. So the American groups are highly supportive of pregnant women getting that vaccine, absolutely. We do know on the flip side that COVID infection and pregnancy do exist together and create a higher risk scenario. So pregnant women who get COVID infections are considered to be the higher risk groups for intubation, so needing a breathing tube, and for needing more complex ICU care. We have taken care of over 300 pregnant women with COVID infections in the upstate, many of whom needed inpatient care. So as a bias, a personal bias, I'm strongly in favor of vaccination. I too was with Dr. Ahuja, kind of elbowing folks metaphorically to the front of the line, and would not blink if I were pregnant about getting this vaccine.
Thank you so much, Dr. Eigelberger. With that, there's some groups who have been concerned or nervous about the vaccine, like minority groups. I'm going to go to Dr. Jones and then to Dr. Ravilla. And so, Dr. Jones, here I come. There you go. Dr. Jones.
Hi, thank you, Tammy. You know, as a family medicine practitioner in the clinic, you know, having the conversations with individuals that come in, I see a lot of minority patients. And so African Americans have lots of questions on, will this be, are we looking at a situation that we've seen in the past, whether that be the Tuskegee trials or any other episodes where minorities have been wronged or harmed in some way as we've learned about medicine. And I'm telling them that this is not the same thing. So I think that for us, it is an opportunity to acknowledge that there have been times in medicine we have not been good to minorities, whether it be women, people of color. But in this case, as we're battling the pandemic, I want to let patients of color, women, know that this vaccine is not set to harm anyone. We really are trying to protect a global population. So, you know, we want to acknowledge that things have happened, but this is not the same thing. This vaccine has been studied in a large group. And while there's always concerns, how many minorities, were there a lot of Black people in there? Were a lot of people of color? Were there a lot of Latino people? And we are always working to improve participation in research. and people of color. But even in this case, there's been nothing to date that says that people of color should be hesitant to get it. If anything, I'm encouraging people of color to get the vaccine, because as we talk to other Black doctors in the United States, we're looking at our states and our graphs. We know that minorities are dying at a higher rate of complications from COVID or the infection itself. And we also know that in those same communities where people are dying, we're seeing less enthusiasm about the vaccine. And so we've got to find ways to encourage each other, educate each other. And we know that's going to take tolerance and patience and lots of education. We're signed up for it. And I just want everyone to know that people of color should be just as enthusiastic as getting the vaccine to protect themselves. And they should not have to consider that their color may play a role in how we care for them for COVID-19.
Good deal. Thank you. I'm going to go to Dr. Ravilla, and he can add some conversation on that. Dr. Ravilla?
Thank you very much for inviting me, Tammy. I'm here for two reasons. Number one, I am the chief of neurology here at Prisma Health. As a neurologist, I have seen firsthand and taken care of patients affected by COVID-19. And I can expand on that as much as needed during this conversation in terms of the neurological complications, which can be truly devastating. And number two, because I am a proud member of the Hispanic community here in Greenville, South Carolina. As a Latino physician, I also am in the role of the president of the Hispanic Medical Association at Prisma Health, and I want to reach out to all members of the minority communities, like Dr. Jones said, and in particular to the Hispanic community, to tell them how I feel about this. I feel privileged to have been able to stand in line with my colleagues to get the vaccine. I would have never been late or refused or object to this opportunity. I feel really lucky that I was able to get the vaccine, because I know that it provides me protection against some of the complications of COVID-19. And I wish that we can answer questions from you today that clarify some doubts, which I can certainly hear, not only for friends and family, but even co-workers here at Prisma Health. Thank you.
Thank you. With that, we're going to go back to Dr. Sacoccio. We got a question about whether if you have COVID-19 and recovered, do you still need to get vaccinated?
Yes, absolutely. That is a very important question, and one that we will continue to hear more about and receive more questions, because our COVID rates are still high, though our surge is trending in the right direction. That's a positive. However, this is what we know. We know that if you've had the COVID infection, that does not necessarily mean that you have immunity forever against COVID-19. What we also know is that the research tells us that the COVID-19 vaccine is about 95% efficacious. So we need to have consistency in that herd immunity while we're in the middle of positive COVID infections and post-infections, COVID-19 vaccinations just beginning. We have a long way to go before we have consistency with that immune response within our communities. So in the meantime, it's important to also wear your masks, social distance, avoid those social gatherings. And even if you've been vaccinated, it's important to continue to wear a mask at this time.
Thank you, Dr. Sacoccio. With that, I'm going to go back to Dr. Ahuja. Oh no. Sarah, I think I'm froze. I think I'm froze. See? I don't know. It's just the network is weak.
So even if you've had COVID, you should still get the vaccine, but wait for 14 days from your infection or from the time you're asymptomatic or from your diagnosis, because you don't want to infect the vaccinating providers. And also, we have seen anecdotally, and this is going to be reported very soon, I think, that if you get natural infection and the vaccine too close together, you can have enhanced side effects. Now, there isn't a published peer-reviewed article on this, but there is building evidence around the country. So if you get your first dose You get infection 2 days later, wait for at least 14 days, and you can wait up to a month before getting your second dose. If you've had COVID back in March, you can get your vaccine now, no problem. And the interval is 17 days from your first dose. Your second dose should be given at least 17 days after the first dose and can be given out up to 40 days, but preferably 3 to 4 weeks later. I'll stop there, and I'm trying to see if there are any questions in the chat box for any of.
Dr. Ahuja, can you also address the strands? There's a lot of stories in the media today about strands.
So I'll address the strains in just a second. Yesterday, the CDC, since you've given me the floor, Tammy, then I'm going to take it for another 2 minutes. So the CDC had a large meeting yesterday, a virtual meeting, and where they presented data on some stuff. I just want to share it with all of you and all of you on the call. So far, about 21 million doses have been given in the United States, 21 million. The majority of them have been Pfizer. As I said, less than 50 serious adverse effects. Number one, most people will get some pain, fatigue, muscle aches, take some Tylenol, you'll be fine. The other thing that they talked about was the incidence rate. The incidence rate on new infections are about 1.8% in children under the age of 4 or 5, but it's about 8 to 10%. And that's not the positivity rate, that's the new incidence rate. And then the CDC estimates, I was taken aback by this slide, and I'll just tell you, they estimate that SARS-CoV-2 infection rates per 100,000 in the United States are up to 30%. 30% in the age group of between 18 to 49, because they are taking into account under detection. So they estimate in the age group between 0 to 4, it's 15%. That's how I estimated 15,000 per 100,000 is 15%, right? 30,000 per 100,000 in the age group between 18 and 49. So the bottom line is, I think there is already a high amount of infection, probably not 30%, but at least 15, 20% in some areas, and the vaccine will add to that. And the variants, we all know that as soon as this virus left China, it mutated into what is called the 614 variant. And that has circulated around for many, many months. And then about 3 months ago, the UK found a variant, which was a mutated virus. This virus mutates all the time. It's much smarter than us. It's able to mutate all the time. And there was a mutated virus in the UK that spread very rapidly. It doesn't cause more severe disease, but what's been worrying is that new mutations or new changes in this virus have been detected around the globe, and some of them seem to be more deadly. One of them is the South African variant, and then one of them is a variant from Brazil called the P1 variant. Again, they've got all these fancy names. It's just not clear how deadly they are. Some of them might be more deadly than the previous ones, some of them not, but they are more infectious. Does the vaccine work on them? The vaccine works or seems to work on the UK variant. It may not be very effective on the South Africa variant. Again, don't get worried. We don't have hundreds of cases in the United States. I Googled it 30 seconds ago, and we only have 300 documented cases of the UK variant. I'm sure there are more, and they will increase, but don't panic. Get your vaccine, keep doing your masking and your hand washing and social distancing even after you get the vaccine, and the vaccine can be tweaked. Moderna is already in the process of tweaking its vaccine so that it can treat some of the other variants. So there is more to come, and this story continues to evolve. Tammy, I'm going to shut up there. Hold on, let me put myself on mute.
Thank you. I'm going to go to Dr. Sacoccio. Dr. Sacoccio, we've been working really hard on the rollout of the vaccine in the 1A category. And so now we're going to go to the 1B, we're going to go to the next category. So we're working with the partners, kind of what's our plan that we're putting into place as we go to the next category, or as we know that DHEC will go there.
Yeah, so I also want to temper that excitement, Tammy, we have over 120,000 individuals over the age of 70 that have signed up for the vaccine. Many of them still do not yet have access to the vaccine, as we have limited supply in this state. What we understand from DHEC is they are receiving 63,000 doses a week at this time. We hope that number goes up, but currently that is the challenge that we have. So while we are preparing for additional phase 1B individuals, other than those over the age of 70, that will be our challenge. We have discussed with our business health partners, with school districts, with churches, that we want to be prepared to provide that vaccine as soon as we have the supply and once we have expansion. And for that reason, our ask of the community is ask these questions, participate in these events, in our question and answer sessions, read what you can, teach folks. If they don't know anything about the vaccine, let's lead them to reliable resources, as we heard from Dr. Ahuja just a moment ago from the CDC, and what information is available. So as soon as the governor approves expansion of phase 1B, then we will also expand enrollment. At Prisma Health, we have worked very diligently in this last week with our entire team to ensure we have a better process in place that will not necessarily require an email, especially for those who don't have access to email. You may have heard our press conference or information that was released yesterday that we are accepting walk-ins on a limited basis. Unfortunately, we have the capacity to vaccinate 10,000 people a day. However, we are not receiving that level of supply. As we hear, the entire state only receives 63,000 vaccines to be available to the public per week.
With that, we're going to go back to Dr. Ravella. Dr. Ravella, you had mentioned that you had seen some of the devastating neurologist effects of the vaccine, of COVID-19. And I just want you to talk about that just a little for a few minutes, or for a little bit, to just illustrate to people another reason why they should get their vaccine, some of the things that you're seeing.
Absolutely. Thank you, Tammy. We have seen many patients admitted to the hospital, and also patients in the outpatient clinic as well, with some neurologically devastating complications. Example, stroke. Since the onset of the pandemic, all around the world, there were cases reported of younger patients affected by stroke who had infection with this virus. So stroke is an important one. There seems to be an increased tendency of the blood to clot and cause a stroke. So that's the first one. Number 2, seizures. Number 3, headaches. Number 4, encephalitis, which is an inflammation of the brain. And not only the central nervous system or the brain can be affected, the virus can also affect the peripheral nerves. And there's a condition called Guillain-Barré syndrome, where the patient becomes weak, initially in the lower extremities, but the whole body can become weak. There can be polyneuropathy or neuropathy, a disease of the peripheral nerves. There can be impairment of smell, which is one of the early symptoms in COVID-19 infection. That's called anosmia. Patients report a loss of the sense of smell or taste of food, for example. The muscles can be affected. That is called myopathy. And then after the infection, and even probably as concerning, we have seen patients who have lingering symptoms of COVID-19 for many weeks and months, and there's not enough follow-up yet to determine how long these symptoms are going to last. But in our neurology clinic, we are seeing patients who have consequences of having the infection in the past, and some of them have balance problems and trouble walking, dizziness, headaches, intermittent confusion, and a variety of symptoms like that I think are still going to be more and more described in the literature. So that's the importance of using the vaccine and any other way to prevent an infection, so that you don't have any risk of having these devastating neurological complications. Tammy.
Thank you, Dr. Rivera. I'm going to go to Dr. Jones. She had talked about in her last talk about what she's seeing as a family medicine doctor on long-term effects. So Dr. Jones.
Thanks, Tammy. So in my clinic, similar to Dr. Revilla, we're seeing a lot of long-term sequelae to COVID-19. So, probably since March, when people were first coming in to say, I have been infected, we were testing people. I have some patients that were positive in March that I still am treating for shortness of breath, memory loss. I've put 30-year-olds on oxygen because they were still hypoxic. And so, you know, one of the things I hear a lot of people say is that, well, we've been in this pandemic all this time and I haven't gotten infected yet. Or if I did get it, didn't seem to do anything. So maybe I'm okay. And I just want people to understand there's more to this to consider. Okay, I was infected, but did I die? Like, it's not a yes or no thing. There are lots of things in between that we're actively learning. And similar to what Dr. Revilla said, that we don't really know exactly what the progression is going to be, if they're going to fully recover, or what therapies we can give them. We're trying things based on what we know about medicine, what we basically know about when your lungs aren't working, or when your memory has failed, or when your kidneys aren't functioning. But I am seeing a lot of people who are very healthy, who became sick with COVID, who thought they were going to fully recover, and they are not recovered yet. And I do not think that all of the FMLA forms, all of the short-term disability forms, all of the albuterol and codeine and Tylenol and ibuprofen that we're giving you makes you whole. And that is what people want. And as a family medicine doctor, that is what we're thinking about. How do we get you back to your previous baseline and make you whole? And that has become very complicated. And we're seeing more and more cases where the answer to that is we're not sure, or not yet. And when we can get you back, we do not know.
All right, thank you. With that, I'm going to go back to Dr. Ahuja. Dr. Ahuja, we've had a lot of questions about people taking Tylenol and all of that prophylactically, taking it before they even get their vaccine, and then taking it afterwards, even if they don't have any symptoms. And I'd love for you to chat about what people should or should not be doing related to that.
Thank you. And I just answered some of the questions in the chat box about the double masking. Some of the gurus up in DC and Dr. Fauci, etc., started talking about double masking. I think let's start with one mask. Even now, when we go out, people aren't wearing a mask. I go to the gym and there's nobody wearing a mask. I mean, you go to the grocery store, and even now you hear people saying, you know, that the masks are, you know, fake news, but they're not. At least wear one mask. If you want to wear a double mask, I don't know what the evidence there is to back it up. The virus is still the same size. So I don't know how a double mask would help, but Dr. Fauci and other gurus, you know, who are the infectious disease gurus, they are starting to mention this. So keep your ears tuned for this. As far as Tylenol goes, yes, you can take it before the first dose, you can take it after the first dose, you can take it before the second dose. I would recommend that. And definitely take it after the second dose, because most of us, at least I did, you know, had some side effects, but not to the point that most of us didn't need to take the day off. You know, few hours at night of shivering with some Tylenol, and then you should be fine. But again, talk to your supervisor, talk to employee health if you're unable to get to work, if you really feel bad. So talk to your employee health or your supervisor. One more question, Tammy, that came up was, and we answered that audience question, I got my first vaccine, then over a week later tested positive. And I think we answered that. You got your first dose, you got infected a week later, you should wait at least 14 days from your infection, at least 14 days, and you can wait up to a month or even up to 40 days before getting your second dose. But at least 14 days from your diagnosis, you should wait to get the second dose.
Good deal. Thank you. I'm going to go back to Dr. Sacoccio. Dr. Sacoccio, there's a lot of questions about because of the availability of the vaccine, people not being able to get it in the window that they thought they originally had been told. So can you talk a little bit about when your second dose, if you don't get it exactly on schedule, or if the schedule is a little different now, can you talk about that?
This is a challenge that we're having with severely limited supply to the vaccine. While we are receiving allocated second doses, we are balancing between first doses, second doses, and walk-in so that everyone has access to this vaccine according to their phase that they're a part of. So, Tammy, I think what's important for this message is that people understand that the number 21 or 21 days after receiving the first dose is not necessarily a magical number, but it's the number that the research points to. The efficacy of the vaccine seems to marry up with the 21-day follow-up specific for the Pfizer vaccine. Moderna is different. Moderna is 28 days. The CDC has recently released additional information. Now what they are sharing is they are confident with the efficacy results if the vaccine is received anywhere between the 21-day mark and up to 6 weeks or 42 days. So just in case there is not supply available, or you miss your appointment, or you would like to reschedule, know this, that vaccine is efficacious between 21 days and 42 days. Now, some may ask, well, what about the 17 days I've heard about? And yes, there is a 4-day window before that 21-day mark. So keep that in mind. And when you're scheduling your appointment, it's okay if it's not exactly on day 21.
Good, thank you. We're going to go back to Dr. Eigelberger now. I was just going to ask her, what is she seeing in her practice as an OBGYN that people maybe have concerns about? What are you talking with them about? And then what other advice would you give to moms out there?
Sure. So one of the things that we're seeing is obviously heightened concern around infant protection and saying, what can I do to keep my little one safe as well? So one of the things that we recommend is a couple of weeks before delivery that the families go into a more intense quarantine period where they really stop going out to the extent that they can do. Women who are working are frequently taking 2 weeks additional leave prior to delivery to mask, to stay at home, and to really reduce the chance of being asymptomatically positive around the time of delivery. Pregnant women, just like the general population, tend to fall into 3 groups: the group who are asymptomatic or very mildly symptomatic with the infection, a much smaller group who are moderately symptomatic, and then about 5% of people who are critically symptomatic and very ill. So we are right now at the Prisma Health hospitals doing universal screening for women when they come into labor, just like we are for every other patient in the hospital system, so that we can help risk stratify and protect that little one. So good hand hygiene, good masking, etc. The risk, when we think about risks, sometimes the choice not to get a vaccine feels like the choice to avoid a risk. And one of the things that's really hard right now is there's not a risk-free option that is on the table for us living in South Carolina during a pandemic. There's a risk of being unvaccinated and unimmunized against a virus and a mutating virus that is highly endemic in our population. And then there's a risk that is the risk of the unknown with a vaccine. So we're encouraging every pregnant woman to make a choice that is comfortable for her, but recognizing kind of those competing risks on either side. We certainly, after delivery, always recommend nesting with little ones, not taking them out in public unless necessary because of other infections that are going around, and certainly no different with COVID. We've had several families who have had novel infections in the home from beloved grandparents or aunts and uncles who felt like they were very safe and had been doing extremely low risk behavior coming in to hold that baby, and then the entire nest being infected. So really, if you are compliant 96% of the time, but then go out 2 times to do something, it is possible and maybe probable, depending on community prevalence, that you could bring that virus back into that nest. So we're just recommending things that feel more extreme than normal in terms of protecting that household. But we also know that this is time limited. We're looking forward to a day when there's herd immunity and we're not talking about COVID every day.
Right. Thank you, Dr. Eigelberg. I'm going to go back to Dr. Ahuja for a clarification for Dr. Ahuja, someone is asking for clarification. If you get the vaccine and then you get exposed to COVID after receiving the vaccine, will it prevent you from getting COVID, or will it just make symptoms less severe?
And the answer to that is both. I was actually trying to type an answer in the chat box. And Tammy, just for clarification, the answers that I've typed in, are they just available for the speakers or all the participants?
No, just for the speakers.
Oh, that's not good then, because I'm preaching to the choir here. They already know these answers, so they can't. So that's anyway. So I thought all the participants could see the answers. So I put some answers in the chat box, but anyway, maybe Sarah can relay them on. But yes, the whole purpose of getting the vaccine is that when you get the vaccine, you develop immunity to infections. So if I get the first dose today, 14 days later, there is a 50% less likelihood that I can get infected even if I get exposed to COVID. After I get my second dose, 21 days later with the Pfizer or 28 days later with the Moderna vaccine, 7 to 14 days after the second dose, these vaccines are supposed to be 95% efficacious. What does that mean? If 100 people are exposed to COVID, if they are vaccinated, and they are 2 weeks after the vaccine, 95 of them should be protected from infection. That is what it means. 95 out of 100 will be up to 95. Up to, again, remember these studies are still evaluating stuff, but currently it is believed that up to 95% will be protected from infection. And even if I am in the 5% that does get infected, the virus enters my nose, multiplies, goes down into my lungs, sets up shop, causes infection. My illness is going to be significantly severe. So it prevents infection, it reduces the severity of the illness, and you don't carry the virus around in your nose for 10, 12 days, so you don't give it to other people. So you're helping the community, helping yourself, and you're much, much, much less likely to get infected.
Good, thank you. We're going to go back to Dr. Rivera. I was just going to ask him what kind of concerns he's hearing from the Latino Hispanic community related to the, and then how we might address some of those.
Absolutely. The most common question I receive is, of course, what are the risks of the vaccine? And my answer is along the lines of my colleagues, let's get vaccinated. The second most common question I receive is, if I get the vaccine, can I then gather in groups? We tend to have big parties, loud parties. We get together for any little opportunity in general. And the answer is no. Even with the vaccine, you have to keep practicing social isolation, social distancing, as we call it, wearing masks, etc. So I was vaccinated. We wear our masks at all times at work. Wear your mask, continue to wear your mask, continue to maintain social distancing. Again, I recommend to minimize the risk by not gathering in large groups or with people who are not from your their immediate family. But those seem to be the two most common questions regarding the safety of the vaccine and regarding, are we able to get together in large groups without masks after the vaccine? And again, just to make sure everybody understands, we are all using masks and maintaining the social distancing, even after the fact that we were vaccinated.
All right. With that, I'm going to go back to Dr. Jones because I saw her smiling about agreeing with Dr. Rivera about what he was saying about that. So, Dr. Jones.
So, Dr. Ravi and I have, similar experiences is that I know, like, particularly in African-American communities, like, big celebrations are a big deal. I, have watched on Facebook and Instagram, talked to friends and families where everybody's trying to navigate how we do these big parties. And, the first answer is, let's not do them right now. Okay, that's the first answer. Like, can we not celebrate to the max at this very moment? But one of the things that I wanted to talk about is that there seems to be this idea that you can be nervous and skeptical and still get your vaccine. And they don't have to be conflicting. So, in medicine, when you go through training, whether that be a medical student or a resident or ongoing learning, as an attending physician, skepticism is a part of the name of the game. It's how we learn, right? To be inquisitive and be suspicious makes us open up the text. It makes us read articles. It makes us want to learn more. So we are very comfortable in the idea that people are unsure or you need more information. Now, we do that drives our learning in medicine. For the general population, what I don't want that to do is then drive your decision to say, I feel uneasy, this feels new, so then I will not get it. And in a lot of Black communities, that's what's happening. Like, I don't know about this. So maybe since it doesn't feel right in my spirit, maybe the Lord is telling me no. That is not it. Okay. You can be nervous. You can be feeling like you need more questions answered, but it's still okay to have all that happen and still say, but I am going to get this vaccine because I know it's going to protect me. It's going to protect the people in my home, and it's going to protect the people in my community. And so It's one of the things that I've been having a lot of conversations this week alone in the clinic to say, but I feel so nervous, can I still get it? And the answers have been yes. And we've been going through all the question and answering with every individual that's been in my office. And I think, are getting more and more people to feel comfortable with the idea that you can still protect yourself, even as you're trying to learn more.
All right, well, there's also, we wanted to mention about the fact that the infection rate and mortality is higher in the African-American and Latino communities. Can you talk about that for a sec?
Absolutely. So, in African American and Latino communities, we've got high comorbidities. So we come through the door kind of at a deficit. So before, January, we were already like in the trenches discussing diabetes and hypertension, morbid obesity, COPD, emphysema. We were trying to fix tobacco issues, trying to decrease drinking, trying to improve eating habits, trying to find ways to get, people to exercise in their communities where sometimes, depending on where you live, you don't have access to good gyms, good foods. We were talking about food deserts. All those things were existing before we got here. And so a lot of people, will talk about the fact that the COVID-19 infection, the COVID-19 syndrome further exposed the deficiencies in these communities and further exposed the fact that we were already having a hard time keeping people very healthy. Now that we're in a pandemic, we are seeing higher rates because if people are already sick at baseline and then they get exposed because they have to work, they have to get groceries, or someone in the house has to do those things, we're seeing increased morbidity and mortality. And so, that's the reality of what it is. It, puts more on our place to say, how do we fix both? And we're working hard to do that. But that is a reality. We are dying at higher rates for lots of reasons. And it means that we also need to push these communities to say, tell me what you need from me to help me protect you. What do you need me to answer? What information do you need? Tell me how to make you comfortable so that we can get you what you need to keep you safe, because we were already working hard on safety issues from the beginning due to comorbidities.
Yeah. With that, I'm going to go back to Dr. Sacoccio. That is all the questions that we have right now, but I'd like to just have her chat about all the efforts that Prisma Health has done to try to help people get their vaccine. And then as we, just in general, and anything else that she would like to add on that.
At Prisma Health, we have been focused on serving with compassion and inspiring health. And the way we do this differently is focusing not only on those who have access or digital literacy, but also those who are struggling. For those who don't have family, those who don't have friends or people to help engage in this requirement of email addresses. This is a new era, and the light has been shined through this COVID-19 pandemic on the disparities that we are seeing for so many different reasons, whether it's because of color, ethnicity, if it's because of geographic disparity or access to broadband or technology. We have got to be a part of solving this problem. And this is why we have partnered with the community, our community leadership, and organizations that help support everyone to have equitable access to health. And now we know this, and the message has been sent loud and clear that digital literacy also tells us whether or not people have access to care. So for that reason, there are many things that we've done, Tammy, to help support these individuals. We have trained folks up on the VAM system. The VAMs are the Vaccination Administration monitoring system that was developed by the CDC or by the federal government, is what South Carolina is using to get access to the vaccine. Unfortunately, the requirement is an email. For this reason, we quickly changed gears and decided we need a better way to reach our community. While we'll continue to participate and document within the VAM system, we are utilizing our electronic medical record, or EPIC, to help support patients. For one, emails can be used, but it is not the only way to get access to this life-saving vaccine. Going forward, we will be able to schedule individuals as early as next week on site without an email required. So that is something we're doing. In the meantime, most of our sites, and you'll see on our webpage at www.prismahealth.org/vaccine, where we are actively accepting walk-ins. These walk-ins are individuals that are either due for their second dose or it can be for their first dose if they have not been able to tap into the VAMS system. As of February 1, so next week, Epic will be a support system for us. We have trained up many individuals to answer these questions. In addition, we have our phone number, 8332-PRISMA, that is available to the public. If they have questions, we can answer those questions. We can also pre-schedule you. And what must be probably our most efficient way to tap into the vaccine if you're struggling with enrollment is our online form. That's again at the prismahealth.org/vaccine site. This online form pre-schedules you into the system. And at Prisma Health, we are taking those lists and batching them into VAMS currently. And you'll hear more in the near future from our communications team about the transition to Epic. But don't worry, if you do have an appointment in the system through VAMS, that appointment will still be honored next week as we transition in the system. We will not be canceling those appointments. Some people have asked that question, Tammy. What happens? Why did my VAMS appointment get canceled? Well, we don't always understand why the appointment has been canceled. Please know that is not something we are intentionally doing, but something that we don't necessarily have control over with the national VAMS system. If you had an appointment and if it was canceled, show up anyway. Show up on the day that you have an appointment scheduled, and we will honor that appointment.
Thank you. With that, I want to go back to Dr. Eichelberger. She wanted to add something.
Oh, sure. Thank you. I just wanted to say one of the beautiful questions that we have gotten in healthcare, we have just been filled up with grace and gratitude from the community, folks coming out and covering the hospitals in chalk art or sending in donuts or just words of praise that honestly on really hard, really long, really sad days have been an extraordinary blessing to us. So first, thank you for that. But one of the questions that has come is, how can we help you? I feel powerless to help you. And this is one of those scenarios where it has become increasingly clear to me that leadership in our community is not necessarily it does not need to be from an elected position or folks in traditional seats of power, that leadership and influence really come from you stepping up and representing good science and good public health practice in your community. And so my ask of all of you watching this, for those of you who have decided to get vaccines, for those of you who sit in pulpits, who are leaders at the grocery store, who are teachers, who are, just a person in your community who speaks up and who uses his or her voice, please continue to tell the story of getting the vaccine and to normalize that behavior for folks, and continue to lead by example with masking and hand hygiene. The power of positive influence that you have is actually incredible. And I also just wanted to share a story of being at the vaccine sites. We have two big sites at Prisma Health, one here in the upstate and one in the Midlands. And it has been humbling watching neighbors driving other neighbors. Obviously, the folks we're vaccinating right now are all over 70, so some of those folks have some comorbidities and some mobility issues, and just the sweetness of watching the community come out and love on ourselves and each other, and watching South Carolina do what we do so well. So I just, tremendous pride in the state, tremendous love for the state, and a real desire for everybody to just help each other out, like share good stories and help each other get to the vaccine sites. So never underestimate your power to be a leader. That's it.
Thank you so much, Dr. Eichelberger. I think everybody on this group, on this panel is a leader, and we thank each of them for giving back to the community in the way they do. I mean, the pandemic has really shown, they always say you show your true colors, and this, our Prisma Health and these group of experts have definitely done that. So for those of you who weren't on when I started, I'd like to just say who everybody is in case you missed them. So we had Divya Ahuja, one of our physicians who's infectious disease, Casey Eichelberger, who's one of our OBGYNs in the upstate, Dr. Jackie Jones, who's family medicine, Dr. Freddie Rivola Rondon, who's a neurologist, and Dr. Saria Sakochia, who's the chair of our COVID-19 vaccine task force. If you have additional questions, please put them in the chat, and Prisma Health will work hard to try to get you some answers. That is what we've been doing this whole pandemic, working really hard to help our neighbors. I think Dr. Eichelberger said it well. We are all leaders in this community, each and every one of us. And so we all have to do our part. I'll have to say that I actually sent a note to my own sorority saying, I'm trying to get everybody I know 70 above out there, almost like getting people to the polls. How can we get
Yes.
people to the vaccination sites? So let's all do our part. We thank you so much. And if there's something else that we can do in your community to help you, please let us know. Thank you. And we hope you'll join us next time. Thank you. Have a great day.
Thank you all. Thanks.